All right, good morning. Happy holidays, season's greetings to everyone. And welcome to our December 20th, 2023 last meeting of the year for the Commission on Women. Pardon me while I swing around and read the screen here. 1 second. All right, should be ready to go. All right, it is 10:03 and I'll go ahead and call our meeting to order. I want to say thank you and welcome. Today we have Dr. Reshma Khan with the ICNA Relief Women's Center. She's the Director of Health Services. It's a relief center that also, well, she'll give into more details, but it's an amazing opportunity for our community to actually see what's going on in different areas of our community. And we're really happy to help and support Dr. Khan in this space. So Dr. Khan, I'm going to turn it over to you, and I look forward to having your presentation.
Thank you, Tricia, so much. Good morning, everybody. Happy holidays. It's a pleasure to be here. Thank you for this opportunity to allowing me to present the work that we do at Shifa Clinic. Would it be okay if I shared the screen?
Absolutely.
Okay. Let's see if this is possible. Okay, so I think screen sharing has been disabled.
Uh-oh. Okay, Jeremy. Do I need to do anything on my end? Sorry, Dr. Khan, hold on 1 second.
No worries, no worries. Or I can send the presentation to you if that's easier.
Let's see. Okay, Jeremy, are you still with me? I see him still with us. Can you
Yes.
Can you allow Dr. Khan to present, please?
Oh, I'm no longer host.
Oh, how did that happen? All right.
You should be able to do it from your laptop as well.
Oh, from my laptop as well? Okay, hold on. I'll just see here if I can't do this. Hold on 1 second, Dr. Khan.
No worries.
I'm going to make you co-host, and then you should be able to now share.
Okay. Oh, yes, I'm able to share now.
Excellent.
Okay. All right. Is everybody able to see the screen?
It is looking beautiful.
Awesome. Awesome. So good morning, everybody. And my name is Reshma Khan. I am the medical director for the Shifa Free Clinic. Today, we will share some information about the clinic and the work that we do together as a team, and also with the help of a lot of different organizations. So let's see how, I hope it goes next. Let me go to the next one. Okay. So today we have like a 6-point agenda, quick, would be a brief history about the clinic, the services that we provide, the community impact that the clinic has on the community itself, some statistics, very simple, basic ones, and then some volunteer opportunities. I always like to start a quote from Oprah. She said something very true. It seems like the key to realizing a dream is to focus not on success, but significance of it. And then even the small steps and the little victories along your path will take on a greater meaning. And I feel that is so much Shifa itself, that the small steps that we have taken over the period of last 10 years has taken on a greater meaning to where we are now. Shifa Clinic is a bouquet of diversity. And as you see, these are all the people that make Shifa Clinic possible. It is our volunteer providers, our advisory board members, our staff, our team members. And looking at this picture, you could see diversity all around. And that's where our strength lies. A little bit about the ICNA Relief logo to explain what does those colors and what the logo means itself. The circle is an illustration of continuity of life, that no matter what, we continue to work and the life continues, irrespective of the people who are here. If I'm not there, we still would like the work to continue. So the circular emblem resembles that. The wheat in the center of this, in the circle is a symbol of abundance and new life. It portrays how our programs give clients a second chance at life and emphasizes one of our largest programs, which is the hunger prevention program itself. The ICNA stands for Islamic Circle of North America, and which is the parent organization, which helped started the clinic. And the green color is the color of plants, indicating growth and nurturing. It promotes possibility and the hope in future. Relief obviously needs no explanation in terms of the word, but the color, the orange color, is the color of strength and vitality and energy, and it represents the determination of our clients and the enthusiasm of our volunteers. So this is the logo meaning. Our core values are sincerity, sacrifice, and service, and we try our best to live up to these core values. The ICNA Relief National Organization is a national organization, and this map actually needs to be updated. We are now in 36 states across USA, and each chapter has a different program. ICNA Relief total national programs, we have 7 health clinics, we have 12 resource centers, which are family services, we have 48 pantries in 26 different states. We have disaster services, and I'm sorry, I need to adjust the number. It is 71 instead of 17. Then we have responded to 71 disaster responses and started off with Hurricane Katrina. Transitional homes, we have 24 transitional homes, which includes 2 domestic violence shelters as well. And back to school are in 40 different states and locations. So since 2005, the total number of people that have been served through ICNA Relief is close to 4.9 million. And now this is about the national organization. Now we'll focus more on the local Shifa Clinic. And Shifa means healing, and it is a chapter of ICNA Relief that was started in 2012. So the beginning was very humble, started as a 4-hour clinic once a week with only GYN services. And I'm the founder of the clinic. And since I'm an OBGYN, that's all I could start with was only GYN. I did not have any support at that time, no providers, no staff, no money. So it was a very humble beginning with once a week 4-hour clinic. Some of the milestones has been in 2013, we quickly moved to a bigger location, bigger from what we started. Initially was 800 square foot, then we went up to 1,200 square feet, new location, and then added outreach programs, including back to school and hunger and hunger program was started as well, and became accredited by South Carolina Free Clinic Association. 2014 started addition of new services like primary care and expanded the hunger prevention further. 2015, we became a full-time clinic so just in a matter of 2 years, from 2012 to 2015, we became a full-time clinic from Monday through Friday and added an on-site dispensary with free medications for patients to pick up and established a well-established on-site food pantry. Before like 2013, I was doing more like homeless food deliveries, cooking food from home and taking out to the streets. That was more of a hunger prevention. But 2015 was more established food pantry. 2016, we established new collaborations with, Trident residency program, established an eye clinic, and also got approved by USDA, further enhancing our hunger prevention program. 17 was an important year because it was a year of honor and awards for all the work that we had done, addition of specialty clinics, including pediatrics, prenatal, and dermatology clinics. And we also got accredited for our diabetes program. 2018, we established a dental clinic. We ran it for 2.5 to 3 years, but it was not very successful based on the provider availability. So we had to close the dental clinic. And a milestone in 2022 was a new location that was 5,000 square foot, which was double to what we were dealing with before in the past, and it was much needed. So that's our basic small history. Now, what are the services we offer so far? So we have currently a multi-specialty healthcare, which includes primary care, OB, GYN, pediatrics, vision. We offer no-cost labs due to the collaboration with LabCorp. We have an on-site dispensary, which Americares and Direct Relief donates medications towards. And then we also became a member this year of Dispensary of Hope as well. Vaccinations, which include all children vaccinations that are VFC eligible, and adult vaccines. We have selected adult vaccinations as well. And in 2022, we were also a COVID vaccine provider. It's also an academic center for student rotations, and we have a very robust hunger prevention program, which we will talk more about. So the community impact. And we also always say success is a journey, it's not a destination, and we continue to improve, we continue to work hard and strive and learn from all what we could do better. One of our signature program is a prenatal care, very essential. And so it is very strange that we being so developed country, we still rank very high in maternal mortality rate. And South Carolina itself ranks number 8 in the nation for the number of maternal deaths. So looking at the data, these South Carolina government, they said, what is going on? Let us figure out what is happening. So they established a committee, and that committee was called the South Carolina Maternal Morbidity and Mortality Review Committee. This committee worked for 2 years in collecting the data, figuring out what is happening, doing all the research that they needed to do. And finally, in March of 2023, they released the data, and this is what we learned from there. They realized that in 2019, 81.8% of the pregnancy deaths that was investigated by the committee were determined to be preventable. And you can imagine 80% of those deaths could have been prevented. And 29% of those deaths happened while they were pregnant, 45% of those within 42 days of delivery, and 26% between 43 days to 1 year. So this is a very, very distressing statistics that we see. And if you look on this side, you will see that the preventability of deaths rose from 2018 to 2019. And they gave out 4 interventions that they feel would prevent this from happening. And also they gave out the causes. And one of the causes was also the chromosomal abnormalities, which are non-preventable. But what can be prevented? What can be prevented was increasing healthcare access to the prenatal women, clinical intervention when it is needed, to have continuity of care and referrals as needed, and translation services. And this is exactly what the Shifa prenatal program does. We partner with Roper St. Francis, and we could not have done this excellent prenatal program without the support of Roper St. Francis. So Roper St. Francis Healthcare has provided us with a strong prenatal program where now we refer our patients from 32 weeks onwards to transition clinic in North Charleston. This way, the patients get a stable pathway. They know the providers, they get a tour of the hospital, and they have continuity of care as well in case of a C-section needed, induction needed. So that is really beneficial. And then when they deliver, they can come back to us for their postpartum care. And in addition, if they have high-risk pregnancies, which we get a lot, like twin gestations, high blood pressure during pregnancies, diabetes during pregnancy, all twin gestations, all those we are able to refer to a maternal fetal medicine program, and then we co-manage with them. So that's our impact with our prenatal program. You know, I just feel like, what is the ultimate happiness? And I think the ultimate happiness is seeing a smile on your child. And, you know, even when you come out of a very tired day, stressful day, you come home, you see your child smile, you see that they're happy and healthy, and that just melts your stress away. But flip it out and flip in on the opposite section. When you have a child and you're not able to provide the food necessary, the healthcare that is necessary, it is very distressing. So through our prenatal program, we have various programs at the clinic to help the kids, the pediatric range population. And these are children who do not have insurance. And you'll be surprised how many children do not have insurance. These may be kids that come here at a younger age, but they were not born here, so they do not get those benefits. Wellness clinic, we offer them within our facility. We have pediatric board certified providers that come and do the health checkups. We do vaccine clinics at Pinehurst Elementary School, where we work with their guidance counselors and work with their nurses to see what vaccines are required for the children to keep them in school. And our clinic staff, as well as their staff, work together. And once the paperwork and the charts are ready, then a provider goes there to provide the vaccines. We, for some time, had a mental health counseling as well for children only, and that is kind of limited right now. And then, of course, the hunger prevention program for kids, specifically targeted for kids, is we have the child hunger prevention program through two schools. One is the Cainhoy, as well as the Pinehurst, another school in North Charleston, not Pinehurst. These schools, we've been partnering with them for almost 3.5 years now, where we provide them with school bags, kind of like a buddy bag program. In addition, we also have hunger prevention programs at the clinic specifically for children, targeted for children as well. Okay, the other impact of the clinic is greater savings in emergency room cost, and thus helping the local economy. The people that we serve at the clinic are the regular people that you see every day. These are not the people who are a burden on society. They, in fact, are contributing to the society. They are cashiers. They are construction workers. They are your hospitality workers. These are people who are doing their work in the community. But unfortunately, they do not have the insurance, or they do not have the benefits to take care of themselves. Now, when these people get sick, they have only two options. Either they miss work, or they go to ER. That's the only option we have given them. And because of that, the cost that we suffer as taxpayers, or the hospital suffers, is enormous. As you look up here, the average cost to treat a simple bronchitis, if they're seen in primary care physician office, it is $115. If you go at the urgent care center, it's $150. If you go in hospital-based urgent care, that's $275. And you go to ER, that's $1,000. That's a high level of money that can be saved by them seeing at the primary care or a free clinic. Hypertension and diabetes are two of the most common disorders that we see. And $2.3 billion could have been saved if patients obtain the care at a lower cost setting. And for diabetes, 168% uninsured patients with diabetes have more ER visits than those who without. So helping the free clinics, not just the Shifa, but any local free clinic is a help to the state as well as in a totality towards the country economy. We are also a site for training of next generation of providers. So Shifa Clinic we have accredited by MUSC PA program, South University, Charleston Southern University, online several nurse practitioner programs that our students are able to get their hours for them to graduate towards their completion of the program. And in last year, we had 82 students and almost close to 10,000 hours of education was provided in total. This also includes College of Charleston internship programs. We have a very innovative hunger prevention program. Before I go back, I wanted to also add why the training of new generation of providers is essential. There are two reasons for that. Number one, by 2030, by the statistics, it is shown that we would require 30% more primary care providers to help us see the patient population. Now, most of the students, they do not get the rotation here, they go out of state. So keeping them in state helps us to increase that pool of graduating providers that we can keep in state and help our local population. And secondly, these students, they are able to see uninsured, the problems of uninsured, the resources, and it really sows a seed of altruism in them. They may not open a clinic, but they definitely would be more attuned towards helping the uninsured. And I have received so many cards saying that they learned more than medicine here, and which is, I feel, is the greatest benefit that I feel that training these young generation providers, that we are able to sow that seed in their heart. Innovative hunger prevention program cannot be possible without Low Country Food Bank. Low Country Food Bank, we're a member agency of them that has helped us to get other retail stores involved in donations. So for example, Costco, Target, Publix, OP, they help us donate the food as well. And we buy a little bit from Low Country as well. USDA is a big supporter. And this is 2022 statistics, not 2023, because we're still working on those. And this number has considerably increased in 2023. On average, I would say on a monthly basis, we serve around 800 pickups per month. And we have all this through 4 different programs. One is the on-site food pantry, then the child hunger prevention program. There's Fresh Express as a community giveaway. And then there is the home deliveries that Amazon helps us to deliver to people that are unable to come to the clinic to a variety of reasons. Either they're working and they're not able to come to the clinic at that time, or they're elderly, or they are disabled, or they do not have the transportation. So with all those variables, we are able to, with the help of Amazon, to deliver them to the home deliveries. And on average, we are about 250 home deliveries per month. In addition, we have significant outreach programs. Health fairs is a program by itself now. We built that program into our existing workflow, and health fairs have been very successful in screening the uninsured, in letting them know what is the need. And in each of the health fairs that we have done, we have found at least a minimum of 1 or 2 patients that are in significant need of healthcare. Either their blood pressure is 190 or something, or they have a hemoglobin C of A of 13, which is very high. So those patients, that 1 or 2 we definitely find, or they have significant anemia, their hemoglobin is 6.7, and poor people, they are like working with that level of disease. So the health fairs, I feel, has a big impact on the community. Then Fresh Express is, again, something that we do on a regular basis. We have 4 Fresh Expresses in a year, and that is like a community giveaway market style. Turkey giveaways, and then back to school giveaway is also a part of our outreach program. Strong partners leverage financial contributions. Last year, this is again 2022 numbers. We haven't updated it for 2023. We received 2.5 million in-kind donations by collaborators. These are all the organizations that made it happen. These are the organizations that provide us the services at no cost to us, so that we are able to provide the community at no cost. Of those, I've already mentioned a few of them, but Best Chance Network is another one that helps us to provide no-cost cancer screening or breast cancer screening. And CCPN is another one that helps us to provide the colon cancer screening at no cost to patients. We have New Eyes that help us to provide eyeglasses to people that are on the vision for a vision clinic. This is again 2022 because we're working on 2023, but there is annual report on our website with all the details and statistics in that, and pretty soon we'll be uploading the 2023 as well. These numbers have significantly increased in 2023. Numbers now close to around 4,000 something for the medical visits. Unduplicated numbers are around close to 1,124, something around that side. 15% increase in unduplicated from last year. Total value of medications have close to be now 1 million this year, and the vaccines are about the same, I think. Again, our value of services that is calculated, this is 2022 numbers with the in-kind donation, with in-house donation of services, and the value of volunteer hours that has been given close to was 4.2 million, that is 2022, and this year, again, it's much higher. We are certified and accredited by, we received a gold seal by the National Association of Free Clinic for our, for all the different parameters that they have 12 parameters that they kind of accredit or provide the gold seals based on ethics, your legal, your paperwork, your financial transparency, all those, and your workflow, your triage policies, all the different policies that you have. Based on that, they provide gold, silver, bronze, seal, and we received the gold one. Board of Pharmacy, we have a very permit for a pharmacy permit, as well as accredited by South Carolina Free Clinic Association, and also have regular audits by DHEC as well. So there are several ways that volunteers are always needed, and there are several ways that everybody can help in some way or the other. We have hunger prevention needs, and people that we need to help volunteer, not just stocking, loading, unloading, packing boxes, also delivering to the clients on a regular basis. And also next year we'll be also starting up with home deliveries for seniors. So that's going to be a different program by itself that we are working on. We're also working on next year in hunger prevention in going to food desert areas and once a month outside the clinic. We also provide for homeless that our truck goes out for a couple hours for half a day, where our driver and one of the staff members goes out and provides to random homeless people that require food, hygiene kits, anything that they come across, not necessarily homeless, anybody that come across that they need food. And we saw that program was very well received. Medical, we need always people that are intake, help us with intake and administrative work. Events is always a time that volunteers are needed, like health fairs, back to school, turkey giveaway. In addition, we also need helps with skills. If you have a skill in marketing, if you have a skill in PR, if you have a skill in starting a program or in helping with administrative work, this is something that any kind of help is needed, or even help us with fundraising. Those are a great helps that we need. So that's a little bit about the clinic, and I will have some time for questions if anybody has some.
This is amazing. It's open for questions. I know I had asked her, Dr. Khan presented at, oh my goodness, October, what was that women's conference?
Women's Summit, yes, yeah.
Yes, the Women's Summit, and it's absolutely phenomenal. It was a panel, so we also had CJ on the panel as well. But Dr. Khan, I do have a couple plugs, but I'm gonna open it up for everyone else to please ask questions.
Where is the physical location? I didn't see it in your presentation.
Sure. It's located on Clements Ferry Road, 668 Marina Drive.
Okay. I was thinking that's where. Thank you.
Thank you.
So I don't have questions, but because I know the history, very close to what is happening on the ground with Dr. Khan, and definitely the whole community respect, love, and care about all the work that Shifa is doing. But especially the Latino community, definitely Dr. Khan gets to the ground in a way that is impossible to describe. You have to really see on the ground, and that's what I do. So incredible work. I'm very always happy to see her, and it's a champion. Thank you for what you do.
Thank you, Lydia. I know how much you do for the community, so we only can do it together. Thank you.
Yes, ma'am.
Love that.
Dr. Khan, I'm Jamie Roper with the Mayor's Office on Aging with the City of Charleston. First, let me thank you for all the amazing work you do. But let me also tell you, you used to be my doctor
Oh,
many
really?
years ago at the VA hospital.
Oh, wow.
Yes. So I know how an amazing doctor you really, really are. But thank you for all your
so
community
kind.
work.
Yeah.
And I noticed that you mentioned about starting a program with deliveries to seniors. If I can in any way help you with any of your programs,
Awesome.
whether it's senior or the public, please, definitely I will reach out to you and
Awesome.
definitely try to do whatever I can to assist you in all your amazing work.
That is great. That is great. I definitely would like to partner with you because this program is from the USDA and these seniors will get really great boxes and fresh produce. So I would love to partner with you and you can reach out to them. Yes.
Doctor, I want to thank you for an amazing presentation.
Thank
Yeah.
you.
I work in housing, and I'm hopeful. I haven't been to your website yet, but I'm hopeful that your data is on the website. And if not, maybe I can reach out to someone.
Yeah.
And I didn't know if the Shifa Clinic has any land or any donors that would give you land, but I encourage you to look up the pallet shelters because the homeless issue is just ridiculous.
Yes.
If you could look that up just to see, it's a way to get people just off the street. Does the Shifa Clinic, it sounds like you have kitchens, right?
No, we do not have kitchen.
No kitchen? Okay,
No
so you're
kitchen,
just,
only
food is
pantry.
just passing through.
Yes,
Okay.
yeah.
Amazing. And I just want to thank you for what you do. And I don't want to bother you because you seem hyper busy, but who could we reach out to in your organization if we need more information for our organizations?
Oh, definitely. Lupe is my office manager, but you can always reach out to me anytime. I'm always available for people. Don't worry about it. I take time out for everybody. So do not worry about it. Please feel free to reach out anytime.
Thank you very much.
And then I was very honored to actually go and visit and just an amazing facility, number one. So just a rock in the community that I think it's quietly making a huge impression. And it's a sad statistic that we are seeing the increased amount of homelessness in our community. Number one, hunger. I mean,
Yes.
that is just totally blows my mind when we have a natural abundance of food, thank God, and where we live. But having that connection and that outreach piece through Shifa Clinic is just amazing. The infant mortality and the pregnancy mortality that has been a long systemic issue, not just in our state, but nationwide. And, if that is one of the issues that I am going to put on our initiative list for 2024 and even collaborate with all of our amazing resources. So we're not duplicating services, but having the ability to actually reference and have a smooth place to where, you know, our children are thriving. Because if we don't have a thriving community, we don't have a community. So that's one of our tenets on the Commission on Women, and supporting the health of women is vital. So I just wanted to say thank you, thank you, thank you.
Awesome.
I know that this rounded off our year to put a lot of great things in perspective, and also revitalize our spirit come for 2024. So thank you again, Dr. Khan. I
Thank
am
you.
so honored, and you will be seeing our faces.
Yes.
So that's something we will talk about too, if, and I will email the commission, and if, I will share your address, and you will be included in that communication as well, so we can collaborate and organize something else offsite for us.
Thank
But-
you. Appreciate everybody. Thank you so much for your time.
You're very
Thank
welcome. Thank you for your
Thank
time.
you.
You take
Ma-
care.
Okay, thank you. Bye.
All right, bye-bye. All right, excellent stuff. I'll just make sure that I'm still. Okay, good. Oh, she didn't hang up and took my host abilities. We're all good. All right. Ladies, this was phenomenal.
Yes.
I was gonna do a quick review of 2023, but I don't think I can get off of that. But I will. Let me quickly just highlight, we have done an amazing, it's just, all I can say is we've been pretty busy, and we've had a lot of opportunities for, let me grab our tab, for us to really highlight things that are going on that fulfill some of our objectives. So if I missed something, please let me know, but I did this late last night just for us to kind of recap a lot of good things happening. We really didn't get started until March was our first meeting. So we had 8 months of real amazing progress with regards to capturing information that we need to gather so we can really fortify our aim for 2024. Just quickly, in March, the 125th birthday of our amazing Septima P. Clark. They had that play. If everyone was able to attend, it was magnificent. Well done. We had our Tracy McKee of our Chief Innovation Officer. They discussed and reviewed the open data information for us and all of the virtual programs. The city of Charleston really has had a large impact throughout. We had, this is Jordan with the Minority Business Enterprise and Small Business Opportunity Expo that was held on March 31st. We had our very own Mindy Strom with giving us an update from the Mayor's Office for Children, Youth, and Family. And of course, we also have Ms. Jamie Roper here that's always with the Office as well of Mayors that also talked about our seniors. We were pretty busy getting all that information. In April and May, we had Ms. Caker Swinton, the manager of the Human Affairs and Racial Conciliation Commission, present the 10-year plan, go through all of the happenings, things that are going on with that commission, and ensuring that those data points are not forgotten, and shed some light on how we can progress even further in support of that. In May, we extended our discussion because we had 3 full months of a lot of information of what's going on in our community. Just a few points of improving our equity within the city of Charleston, really important. I'm a firm believer of economic prosperity. That is the heart and the foundation of a lot of society's ills, and financial education is important. And that ripples through all of our social norms of a healthy community. Assist in addressing our affordable housing. Assist with improving the commission's website for community outreach. That was done. So really applaud Councilwoman Caroline on that. To assist with increasing our awareness of human trafficking. That is just no need to say that. We had a really great presentation on that. To assist with increasing awareness of programs, helping the education of financial literacy, and help REN, Women's Rights and Empowerment Network, and some of their initiatives. Of course, we cannot be remiss without mentioning the abortion issue coming up. That led us into executive session for June and July for obvious reasons. And for us to really start talking about how we can be an extra formidable force together as a commission, and talk about how we can create working groups, or what we need to do to actually be more strategic and more effective. So October came around, and it was National Women's Small Business Month and Human Trafficking Awareness Month. We had our special guest, Ms. Dorothea Bernique, the founder of Increasing Hope Women's Business Center. We also have that phenomenal presentation with Tri-County Human Trafficking Council. As you can see, in November, and I apologize, I wasn't able to get our stuff on the calendar quick enough, so we did not have November. But here we are in December to wrap up all of those great points. And I really want to say thank you. And for those who aren't here, I did bring some Christmas assortments. And it's pretty cold, so probably we won't stay fresh till our next visit, but definitely is here. You guys are missing that. And one of the things too that we really, next year is election year, and we're already in the election cycle. So, you know, the commission, the National Association, the Commission on Women, we probably need to revisit becoming and renewing our membership with that organization, so we can, there's plenty to be done for sure. But when we have a force and a larger support mechanism behind us, we can certainly progress forward and be strategic with our activities and our energy. And then one of the things that I did ask, and I sent out for everyone to please review the member listing. I really want to send that out before Friday to the clerk to make sure that everyone's preferred method of contact is properly displayed to our community, and for us to really start thinking about a specific day that we want to meet in January to find a space for a couple of hours to, as you can see, we were certainly not bored this in the past 8 months. Plenty of things for us to go through, talk through, and align with our mission as a commission, and see where we can definitely support each other and support our community. So that is my presentation that I wanted to share, and absolutely open to discussion as well. And just wanted to hear some feedback on where we can possibly share this really quick. Stop sharing, and I apologize. I wanted to make sure this was still up. 1 second, and so Miss Gadsden. This, that wonderful picture. Can't get up here, but definitely if everyone can see that, I'm gonna please share, because that was phenomenal.
Good morning, ladies, and thanks, Tricia. I'm truly appreciative of your allowing me to share. I am honored by the invitation to share a brief sketch of a memorable visit to the White House on November the 13th.
Excellent.
Yes,
Yes.
thank you so much. I made some notes so I wouldn't ramble on. I know we have time limit, and I would just hoping that I would receive a tape that I had requested of the visit, and they will be sending it, and I'll send it to you, and maybe later we can share more on that. As one of a group of 60 women in the center of living history, it's something I won't ever forget. It was certainly my delight and honor to have received an invitation extended by First Lady Jill Biden to Women in Leadership. And that's a group out of South Carolina that I would like to see us make connection. I have someone come and speak to us, primarily dealing with women, looking at seats in various areas that we could serve in politically also. It was also a makeup of faith leaders, and I just concluded a 5-year term as president of the Women's Baptist Educational Missionary Convention with a makeup of about 700 churches. And
Mind blown.
I'm still trying to wind down.
Wow.
I don't know if I'll ever wind down, but I'm trying. And as one of the female, I was proud and excited to have represented Charleston, the Charleston area, at the invitation-only tea and celebration of Thanksgiving season. The travel was very taxing for me, but worth the time. I drove to Charleston the night before to catch a 6:30 flight the next morning to Washington, D.C., and taking a 10:30 flight back to Columbia on the same day, which was delayed twice, with my arriving back in Columbia at 1 a.m. in the morning with an 8 o'clock meeting in Columbia on my agenda. So I was jet lagged for a week or two. The significance of our visit to the White House began with a reception, followed with 2 hours of discussion held in the Blue Room, moderated by First Lady Biden, and the opportunity afforded to us to share concerns and questions on important issues relating to women and their families. A lot of what we discuss here. And so I felt like I was prepared once I realized what it was going to be all about. I was so excited. I didn't ask what we were going to discuss. I just wanted to be there. And we discussed health and medication, rising costs and gun violence in our cities, caregiving resources available, mental health, funding and care, child care for working women and mothers. These are just a few. And today I heard some more today. But again, when I received the tape that the White House said they would provide for me, I will provide a list. First Lady Biden and other White House staff responded to all of our concerns presented and questions, and the session was recorded. And at the close of the session, we received assurance that it would be shared with President Biden. And we said that we will be following up on that. And after the roundtable discussion, we were afforded the opportunity to tour the Blue Room and hallways with pictures of former presidents and former first ladies displayed on the wall, and they allowed us, and believe me, security, you have to make sure you stay where they say stay, or you can't just roam all over. And my son, who is a federal officer, he said, Mom, just make sure you don't wander off now. We don't want to come to Washington after get you out of jail. But they allowed us to take individual photos and remembrance of our visit to the White House. And then our First Lady Biden was so gracious to take individual pictures with us. It was just a delight and blessed opportunity for all. We left in awe. I know personally, I will never forget it. And our First Lady of the United States was a gracious host. This was not my first time meeting her. I met and had the opportunity to talk with her on at least 2 occasions prior to the invitation. And so I was just, I couldn't believe I even received an invitation, but she was just a delight. And the group consists of attorneys, educators, social workers, healthcare providers, women seeking political office, and business professionals. And we had a wonderful time. Women in leadership. Thank you again for just giving me this brief moment to share that. I'm still excited. I'm still excited about it. And I appreciate all that you're doing. And I appreciate this commission. And I don't take it lightly. There's just so much we can do. And I heard it said by I think it was Dr. Khan, if we come together as one, about saving lives and changing lives for the better. And that should be the forefront for all of us. Thank you.
Absolutely. You are very welcome. We are honored. Wow, we're honored. Thank you. I'm truly speechless because it just brings into envision that we as women really are the anchor for our society, and not just the anchor, but we are also almost 90% of the time the initiators for change. So I am humbled and great and just full of gratitude that you are part of our commission, that you represented South Carolina, no doubt, stellar, and really bringing back to us in our community a lot of golden nuggets for us to. January cannot come quick enough, but we're gonna savor the moment and in deep appreciation that each and every one of you and because we certainly are a force to reckon with, and
That's right.
I am humbled to be the chairwoman, to take everything and each and every one of our talents and gifts, so we can create history every day.
Yes.
So
Yes,
thank
we
you.
can.
Time check, it's 10:55, and opening it up for additional discussion. So please, want to hear from you.
I have a very quick question, quick statement. First of all, happy holidays to everybody. The housing crisis, I can't tell you how it is just increasing. Rents throughout the region are going up $300 to $500 a month. And if you look at the new apartments being built, it's obscene as to what the rents are being charged. So the homeless crisis is just continuing, and it's at all ages. It's young people, it's people in their 20s and 30s, it's senior people. So what I want to just ask everybody, if you know of anyone who has land where we could add an additional dwelling unit, please have them contact me. The communities pretty much fight us on new construction, but additional dwelling units, we can help a lot of people as a first step. And we're going to be working more closely with the county for federal funding to keep land in people's hands, and then build those additional dwelling units to help them, their families, and other people in the community. So please help any way you can by having them reach out to me. Thank you and Merry Christmas.
You're welcome, Denise. Thank you, and Merry Christmas to you as well. All right, anyone else for the greater good? All right, so I am going to have a motion to adjourn and
Second that emotion, I second that motion.
thank you. I will proceed.
Proceed.
I always mess up my language and all the nuances.
Sorry.
Bear with me. Thank you so much for your patience. I will get it together. Each and every one of you have a wonderful, safe, and happy holiday. Merry Christmas, Happy New Year. You guys will have my notes. Summary, I will get Dr. Khan's presentation and share out as well. And we'll continue our feedback, but please, everyone, stay safe and healthy with your family, and we will see you in 2024. Thank you so
Yeah.
much. We adjourn.
Merry Christmas, everyone.